Okay, you're all set.
Thank you.
Happy August, everybody. Welcome to Board of Health for the month of August. As a reminder, this is live streaming and being recorded. So I'm going to go ahead and call us to order. Bang. To get started. I don't think we have anyone, Frank, correct me if I'm wrong, for privilege of the floor this meeting.
No, we do not.
Okay. So I also wanted to just give a quick welcome to Ravinder, who is our newest member of the Board of Health, who will not be voting today, but will be at our next meeting. But welcome, welcome. And also, before we start the meeting, I wanted to just really quickly let board members know, or show board members the thank you notes. If I could read those really quickly, Frank, from both Karen Bishop and Melissa, which I would pass around if we were together. So as you know, they retired this month. So Karen wanted to pass along, thank you so much for all of your support, retirement wishes, and very generous downtown Ithaca gift card. I will enjoy using the card and supporting downtown businesses. I've thoroughly enjoyed my public health career and look forward to starting the next life chapter, and all the best to each of you. So thanks to all of you for that. And then from Melissa, thank you for the wonderful downtown Ithaca gift card. What a thoughtful and fun gift. My 35 years working at the health department has gone by so fast, and I've had the pleasure of working with amazing public health professionals. Thank you for all the support you've given to making our community a healthy place to live. So thanks again to everybody on the board who chipped in for that and the card and whatnot. So thanks. So now to official board business is the approval of the July 28th minutes. So could I have someone give me a motion on that, please? So I've got a first from David and a second from Jan. Any discussion on that? Okay, all in favor? Let's do actual hands. And I think that is unanimous. Any opposed, just in case I'm missing, and any abstentions? Okay, yep, great, thanks. Okay, Brenda, financial summary.
Your July financial summary was included in your packet. As it's been for most of the year, we're continuing to monitor our budget based on our response to the pandemic. Some areas are doing okay. Some areas have some significant shortfalls in revenue as we're not able to provide some of our services, although we are looking at alternatives in some areas. Some state funding has been paid. Some state funding is still on hold. Federal funds have started coming in at 100%, and we continue to work on 2 COVID grants that are the original source of funding is CDC, and we continue to work on those and how to allocate them in our budget. Recent activity at the legislature placed $300,000 in our budget for community-wide testing, which I'll let Frank go into probably during his report. So I've been working on that, and I continue to try to support the nursing division.
Great, thanks, Brenda. Any questions for Brenda? Okay. Let's keep moving forward. Sorry, I moved my mouse to the look at your financial summary. So let's go ahead, Frank, and we'll segue right into your report.
Sure, thanks, Christina. And I'll probably just move up the item in the action line, which is our new member. You introduced Ravinder. He did navigate the gauntlet of approval, being the city representative. He had the added step of the mayor recommendation. So all of that's been done, and the legislature has appointed him. He still has to be sworn in, which is why he's not voting today. And once we get that completed, he'll be all set. But I did want to, Ravinder, give you a chance to introduce yourself to the board and give you the floor for a minute.
Oh, great. Thank you so much. Yeah. So first of all, I'm super excited to be part of the board. And just, yeah, to be, sort of more a part of the community. We just recently moved to Lansing like 3 weeks ago. So we're still settling in and not as many boxes as you would imagine. But I'm a faculty member at the hotel school at Cornell. And I teach in the food and beverage area. And definitely when I told my colleagues that I was now on the Board of Health, they were very excited to have a inside line into what's going on in Tompkins County, because we are actually running a restaurant that's open to the public, that usually is staffed by about 30 students per night. But this semester, we're completely changing it. And it's going to be curbside pickup only. And we actually are going to be running the restaurant sort of for the students who are going to be watching us on video. It's going to be very weird, and we're all sort of still trying to figure out what's going to happen. But as we go forward, I will definitely send you along some information, because I think it's probably going to be one of the best food options on campus. And so hopefully, we might be able to get you all to patronize us. But yeah, so I got my master's at Cornell in 2012, and then just sort of never left. And so yeah, we live here in Ludlowville with my wife and our two daughters, who are 5 and 2. And yeah, again, just really excited to be part of this team. It's super important. And yeah, I'm just excited to sort of create some more roots in the community, and help out in any way that I can. Yeah, so thank you everyone for anything you may have done to sort of help me get the job.
Great. Well, welcome again, and we look forward to your participation. I think you'll find this is a good group of folks. They're extremely helpful to the department and helping identify policy. And I think you'll also find that everyone here is very willing to share their thoughts and ideas. So not a normally quiet group. So please feel free to jump in with ideas that you might have. I will be reaching out in the next couple of days to kind of set up an orientation for you, just to get you a bit more familiar with the department, kind of what the role of the board is, and all of those types of things, and answer questions. So we look forward to having you be a part of the board. So welcome.
Great. Thank you so much.
Yep. Great. All right. So I was joking with Christina. This is normally your month off, August, but and we don't really have action items on the agenda. But with COVID going on, we thought it was important to at least have a touch point, so I could share a bit about what's going on from our perspective, and then answer questions that you guys might have. I do want to start with Karen Bishop's position. You're all aware that it's vacant. Melissa Gatch has kind of been filling in to lead the communicable disease approach in Karen's absence, but she's going to be retiring at the end of this month. She will be returning 2 days a week, but that's really going to be to help train the new staff that are filling the positions, and really support the transition. So I've asked Brenda Crosby to step in and provide leadership for the division in the interim. So she spent the last few weeks, as she said, getting familiar with the work that they're doing, and preparing to support them. She's going to relocate herself downstairs for the foreseeable future until we get Karen's successor identified. Along those lines, we have applicants, and putting together a hiring committee, and hope to be doing interviews probably later next week to see what we have in the applicant pool from there. So there were strong candidates, so I'm hopeful that we'll be able to find somebody out of this group, which will be a big help as we move forward. As far as COVID is going, we continue to be extremely fortunate with low incidence of disease in the community. That's probably the good news. One of the biggest challenges that we've had is there's been a lot going on in the last few weeks related to higher ed, as well as K through 12. I'll start with higher ed. I think everyone heard the Ithaca College announcement that they are going fully remote. So that was a bit of a shift, and they're working through their processes in preparation for their fall semester, but doing it remotely. Christina has been appointed into an official role. I guess I'll let her explain what that is at Ithaca College, but we're excited to have her, in a leadership role in their COVID activities on campus. Christina, did you want to share that new role?
Sure. So it's a role that we have created, at least for the next academic year. It's going to be, the official title of it is the Director for Public Health Emergency Preparedness. And, for us, it was a recognition that the complexity of a responding to COVID in higher ed just was really going to require someone whose job that was to help weave all of the pieces together, because it's basically like a small city, and having somebody in a position to help with the coordination and making sure that that we're complying with the New York Forward Plan, but also being able to really help the different areas of Ithaca College coordinate and collaborate as effectively as we possibly can, was an important part of will be an important part of that position. So.
Great, thanks, Christina. Yeah, and I think it just shows, that Ithaca College, as well as all of our higher ed, are taking this extremely seriously and are looking at ways to, both help their campus communities as well as the broader communities navigate the future in a COVID world. So that was Ithaca College's big shift in the last few weeks. Cornell has begun to bring on-campus students back. So last week on Monday was the return of students from the high incidence states. So you may remember, I think it was before our last meeting. It's hard to keep track of time anymore. Cornell made a shift to not bring students on campus that reside on campus from high incidence states. They did, however, set up an exemption process for students whose home might not be conducive for multiple reasons, to be able to still return to campus. So that process is completed. There was about 450 so of those students, and we only got a couple of positives to come out of that. So that was really, really good news. We were very happy that the positivity rate was well below any can't pronounce prognostication. I should use words that I know how to pronounce. So that was good news. That was really good news. Over the weekends, starting on Sunday and continuing yesterday, they began to bring back the rest of the students for on-campus residency that are in the non-high incidence states. So there was about 1,200 of them each day, Sunday and Monday, that were tested. And so far, there's only a couple of positives that have come out of those populations as well. So that's all really, really good news, because one of the big hurdles with reactivation of the campuses was, would we be importing disease into the community? And so far, it does not appear that we have. And for those that were positive, they were caught through the testing protocols and are in isolation. So that's really good news. So far, things are going really, really well. There will be more testing. Today is an off day for move-in on campus. They built in a little bit of break, and then I believe starting tomorrow through the weekend, the remainder of on-campus students will be returning to the tune of about 800 a day for the next 3 days or so. So there will continue the process of testing and following up, and we'll hope that the incidence rate remains very, very low. Cornell is also doing their ongoing surveillance testing. So they've begun with the vet school. It's kind of like a soft opening, I guess, for those students that would need the biweekly testing. And so that has begun, and we have not seen you've seen our incidence rates, they've all remained low. So far, all the testing has shown very low incidence of disease, which is really, really good news. Today, Cornell launched their own dashboard. And so that is now out on their COVID page. You can take a look at it. They've created a green, yellow, red, it might even be green, yellow, orange, red kind of scoring process. Those are the color changes are based off of the different levels in the Fraser model, as I understand it. So green would be the optimistic view, yellow would be a middle view, and red would be the pessimistic view that existed within the Fraser model. So they are monitoring and managing them. I will be meeting weekly with the provost and the president to review data with them. So we have now a weekly meeting set up to do that. Obviously, if anything happened in between, we would certainly communicate about that. So things are going well. The behavioral compact for Cornell is out there. Ithaca College has put theirs out as well. So students are beginning to sign on to those. We do expect that the behavioral compact, as well as the full-scale surveillance testing, has a kind of an official full-scale kickoff for September 2nd with Cornell. But there's obviously testing that's going on in between then and now as well. So that's Cornell. We did door hangers as well. So Liz and her team, in cooperation with law enforcement, have taken on kind of the complaint response component. So we've been giving out the non-emergent dispatch number for gatherings over 50, gatherings of any size where social distancing or mask wearing isn't observed. And so those calls come into dispatch, and local law enforcement are responding. They're responding with an education approach. We're not, it's not meant to be a strictly, very authoritarian approach. They are trying to, take an educational approach, and I think so far they've had fairly good reactions. Liz and her team are getting that information from dispatch and tracking that and reporting it out to county admin so that it can be monitored. The sheriff has put on an extra patrol on the weekends to cover the city of Ithaca because we do expect that the majority of the calls, and it has started to show itself that the majority of the calls are coming from there. So there is added support that has been implemented.
I have a quick question, Frank.
Sure.
So yeah, we just moved to Ludlowville. Ludlowville Falls is a very popular spot on the weekends when it's 90 degrees out.
Yeah.
And I mean, I haven't been going to like narc on people, but we just walk up to the playground, and I've just noticed that there's a lot of people there, not wearing masks, not really socially distancing. And I mean, is that a situation where we should be contacting the sheriff or?
Yeah, it does fit the definition. I think we're seeing that in a lot of areas where, particularly where water is. So because folks are gathering there to cool off in the summer temperatures. Most of those places are known and attempts are made. It is challenging to necessarily break something like that up that's occurring, because we definitely don't want law enforcement having to be put into those situations. But if there's a concern, it certainly fits the definition. You can definitely call the non-dispatch number at 911.
Okay, thanks.
Yep. So enforcement at the college. TC3 is also working their plans. They've done some testing as well. They focused on their residence halls, so students that are living in their residence hall, rightfully so because of congregate living and the concerns that are associated with that. They did offer it to anyone that wants it, including faculty and staff. I know they had one event with over 100 people tested, and I think maybe today is their next event to do testing again. So they are making testing on campus available as well. So higher ed is moving along, and they're doing a lot of testing and taking a lot of steps to try to protect their communities and the broader Tompkins County communities. While I'm talking about testing, some big news from the legislature this week. Jason presented a resolution to them to fund testing here in Tompkins County. So if you're not aware, the governor, as he's been expanding the criteria for testing, there was an expectation that there would be a reimbursement model for that. After probably 6 or 8 weeks ago now, the federal government made a determination that insurance companies would only need to pay for medically necessary testing, which is sick individuals, symptomatic individuals, close contacts of a case, or the testing related to preoperatory needs are the only things that our insurance are paying for. So all of the other testing for essential workers, phase 1, 2, 3, 4 workers, and protesters that the governor kind of opened over the reopening phases, there's not a reimbursement model, and Cayuga Health Systems has been absorbing those costs. Now there is an expectation that FEMA will pay for 75% of that testing, but it still leaves a 25% coverage loss that CMC would have been bearing, and they just couldn't continue to do that. So they've been working with us at the county here, looking for a solution, and the legislature has agreed that the county will pay for the non-medically necessary testing for Tompkins County residents here moving forward. We will seek reimbursement from FEMA, and then the county would cover the other percentage. So that's really good news. The contract is still being worked out. We're hoping early next week to be announcing that is now in place and available. I do want to say that the $99 that Cayuga Health System started charging, that was not to cover for folks that were under criteria. That was really for individuals that were coming up with, to the site for testing that were travelers and or travelers that might have gone out of state and wanted to get tested. They didn't meet criteria, so they were getting turned away. And rather than turning people away, particularly those that had the ability to pay, they instituted that $99 fee. So I just want to be clear that was not Cayuga Health Systems in some way saying, well, we're just going to start charging everybody. It was really just for a small group of people that were getting turned away at the time. But thankfully, with this new approach from the legislature, there will be funding available, and the testing will continue. K through 12. Big news in the last week or so was Ithaca City School District. They made a shift where they will now be beginning school September 14th, and it will be all virtual until October 5th. We had several conversations with the district leadership, trying to understand and help them understand what was going on. They have a workforce issue. I think about 70% of the teachers that were surveyed said they wanted to work virtually, which made it very difficult for them to navigate an in-person environment for the students. So that is all, that was all part of the thinking that went into it. I think there was also an interest in seeing what happens with higher ed, and what the disease might look like here in Tompkins County over the next few weeks. So this kind of builds in a little bit more time for them to do that. So that's Ithaca City School District. We have not heard that any of the other districts have strayed from their planning that they had already announced. So at least as far as today is concerned, we're expecting that they'll be moving forward with those plans as they were announced. So that's K through 12.
Frank, can I just add to that?
Sure, go ahead, Melissa.
Tonight on the board meeting, Jeff Snedeker, who's a pediatric infectious disease doctor, will be there to answer questions for the board and for the public. I think we all want K through 12 to open, and we're a little disappointed that we had to push back the in-person day. But that's what's happening. So so Jeff Snedeker will be there tonight. There's also a bunch of doctors that are writing an op-ed to talk about why we chose to send our kids in person, you know, the risks and the benefits and how we weighed those, made that choice. Hopefully it'll help people feel more comfortable. And then with the extra time, we are, the nurses are and the staff's getting more training. The nurses will have time to focus on immunizations and PEs and things like that. And we're also going to try to, like I said before, get people who are uninsured onto insurance. And we're working with Kaiga Health Partners.
Great, thanks, Melissa. Yeah, so that kind of brings up another thing, and and now I'm realizing we might not have sent it to you, and I'll ask Sam to send it out. But this week, I sent a letter out through the local media. Didn't get a lot of coverage, but it was really an attempt to kind of kickstart the conversation around the other public health issues that we need to keep our eyes on. We've been very focused on COVID. But pre-COVID, there were public health issues that needed attention, many of which are now exacerbated. I can't get that word right. I got to stop using words I can't say. Are magnified because of COVID. So I just wanted to kind of get that conversation started to make sure that the community knew that we weren't losing sight of those other issues. And part of that was around the narrative, particularly around schools. You know, there are public health issues, whether the kids go back to school or the kids don't go back to school. There are different, you know, issues that are going to be need our attention. And, you know, we just want to make sure that as we're making these decisions, we're looking at the totality of the picture, as Dr. Dundali was referencing. We're going to have some other department heads getting some words out in the next few days. Our Thursday town hall with the community is going to be focused on that a bit more. So it's really important for you all to know as well that, you know, while we are focused on COVID, we do recognize there are other public health issues that continue to need attention, and quite frankly might need more attention because of COVID. And that we are committed to continuing to work on those as well.
Yeah, and Frank, there, you know, there's a bunch of pediatricians who are seeing the effects of COVID and the other, you know, the increase in mental health, and I know they would be helpful and would want to help you. If you need anything, I can contact them.
Sure, great, thanks, Melissa. So I will, I'll stop there now, and I'm happy to answer any questions from anyone on the board.
So Frank, heading into the Labor Day weekend, given that we had our last spike around the 4th of July weekend, in addition to the door hangers, are we doing any other campaigning around that?
Yeah, they were talking about that yesterday. We will be doing some messaging. My hope is that going into next week, we're going to be able to talk about how well kind of the re-entry of students into the community has gone with low incidence of disease. So things are good on that front. And we didn't import a lot of disease. So let's keep that going by also continuing to do the things that we know we're good at, which is social distancing, wearing a mask that we've proven over the summer. And because we have the holiday weekend coming up, it's a good time to remember that we need to continue practicing those things. So that's kind of the approach that I think, assuming everything continues on the same path, that we're likely to take. But we do expect to get information out about Labor Day.
Okay, great, thanks.
This is Jan, and it's probably a good idea to point out what happened after the 4th of July weekend.
Yep.
And also, I'm not sure if it'll help or hurt, but Cornell we actually have classes on Labor Day this fall. So, you know, I mean, who knows if students are actually going to sort of adhere to those rules and guidelines. But we do have classes. You know, the theory is that students are hopefully not going to be heading back home to have parties and barbecues and that sort of thing, and then come back and potentially bring COVID back here.
Okay, Okay, other questions? Comments? Okay, thanks, Frank. Sam, health promotion.
Okay, thanks. Ravinder, it's nice to meet you on here, and I'm the Director of Health Promotion and also serve as the Public Information Officer for the Health Department. So I've been working on the COVID communications team as part of the Emergency Operations Center during COVID. So Frank covered a lot of what I was going to add. No updates to my report, but I'll just add a few other things of recent around COVID. We did release a press release on Saturday about an employee at Simeon's testing positive, and there was testing made available for appointments at the sampling site, even though the students were getting tested as well. So that happened over the past couple of days. Also, gyms and fitness centers have been opening. So as of yesterday, so we have been working with Liz and her team in environmental health. We put out a release about that, informing the public and gym operators what they need to be doing. So Liz may have more to say about that. And yeah, and as of yesterday, 8 active cases in the community. And we re-emphasized last night that our data has and will continue to include all higher ed testing, the numbers and the results. So our positive numbers are unique cases. So as we have these different dashboards and different reporting mechanisms in the community, which is great, but also we just want to be clear about what our data is showing. So that's all I have right now, but if anyone has questions.
Sam, it's Melissa. What do you consider an active case? I think we talked about this before, but I'm not sure.
So active case is a current case that's in isolation, that the nurses have completed their contact investigation and deem a COVID positive case, and they're in isolation and being monitored daily. Frank, anything to add?
Essentially, once they are released from isolation, they're no longer considered an active case because they're no longer contagious.
Hey, any other questions for Sam? Okay, great. Thanks, Sam. Okay, Dr. Klaypak, Medical Director report.
Good afternoon, and welcome to the board, Ravinder. I've been medical director at the health department since 1991. Although it may seem as you come on the board that everything is COVID, as Frank has mentioned, it's not. And there are multiple other issues that we've covered in particularly recent years, last 5 years or so, that at some point in the next month or so, I'd appreciate the opportunity to talk with you and tell you about some of those. In regard to our vaccine clinics, we typically hold vaccine clinics here in the health department to keep children up to date in their vaccinations. These are children who have recently arrived in the area, may not have a primary care practitioner. They may be uninsured. They may be people who struggle in other ways and can't get vaccines other than through our clinic. However, we've been unable to mount vaccine clinics because of the resources that are needed for coronavirus. Last month, or in my report, I talked a bit about this issue and in reaching out to primary care practices in our region. I now have 4 family practices and 1 pediatrics practice that has agreed to take referrals from us of kids who would ordinarily be going through our clinics. So I think I'm hoping to hear from the other pediatric practice and another family practice also. But I think we're in pretty good shape for being able to meet this need, and we've started to refer children to those practitioners. So we'll hope to keep them up to date, and the kids, that is, and address any school needs. There's a lot of things that change as we think and go through coronavirus. And one of the things that has changed for me is how I think about higher education and students and the business of higher education. And that's sort of a mindset that is kind of difficult because you kind of want to put students into some kind of special category. And they do deserve to be in a special category because of their age and their mission and so on. However, they are customers, they are consumers of a product that a business sells, which is higher education. And as we think of controlling coronavirus disease, it's important to think of them as members of the community, members just like any other person that's maybe shops at Targets or goes to a restaurant or any number of things. And as we think about controlling disease and doing our case investigations and looking for cooperation, it's important to keep in mind that these are consumers. They're coming to a consumer product from a local business. That business just happens to draw from a huge area internationally, which is quite uncharacteristic for most of the businesses that we have to deal with. In our case investigations, we most recently have been talking about the reproduction number. And the reproduction number, as you probably are well aware, is that number of people who are going to be infected by an index case of who has active coronavirus. And our mission is to promptly, quickly catch that person very early on, because what we know from the more recent data from the CDC and so on is that our window of opportunity is pretty limited. It's something on the order of less than 10 days, probably more on the order of 7 or 8 days from the time that they initially become infected. And for us to really meaningfully intervene on the spread of that disease, it becomes very important that we have a quick case investigation, that laboratory turnaround times of more than a few days, more than even 1 or 2 days, are simply not acceptable because they limit what we can do for an index case. And then at that point, the most that we can do is through our contact investigation to limit the spread of disease by contacts. So laboratory resources and quick turnarounds are very, very important, as well as new testing modalities, where we can get on to more of a screening test for coronavirus that, although it may not be as accurate as PCR testing, could help us to do even more in terms of controlling the disease and offering it to many, many more people. We're not there yet. This needs a lot of development in the testing arena on a national level. But as we do our case investigations, we've been talking recently in our morning briefings with the communicable disease group about the importance of identifying whether there's a trend going on. What kinds of intervention, what kinds of interventions should we need think of doing based on what we're seeing in cases? So for example, we talked about July 4th. That was a problem of people gathering without using proper protection. But as we go forward in these next few months, we may find that there is maybe a certain area of the county, or maybe there's a certain occupation, or maybe it's a certain lifestyle or something where we should be doing more in the way of, as Frank was saying already had been done, door hangers to make people aware of things, reaching out to them with further interventions, maybe even reaching out with them to them for increased testing, so as to get to a position where we're making meaningful interventions on a subset of our community. So as the nurses are doing their case investigations, I'm encouraging them to keep a mind on the big picture. Is this something indicating a population that we should pay attention to? There's been a change in isolation criteria. The CDC put out a bulletin in this past month. We've begun to employ that, although it hasn't been rolled into formal New York State Department of Health guidelines. For the usual normal person, 10 days of isolation appears to be adequate for controlling their communicability. However, for severely ill people, that would include anybody who's had to be hospitalized, and certainly anybody who's been in the ICU. For severely ill people, or for people who are immunocompromised, 20 days of isolation has pretty much been the recommendation. So we do make a distinction how long we isolate people before we release them. And that sometimes causes public misunderstanding. Why am I still in isolation when this other person who is my contact is out of quarantine already? That sometimes is something you might hear in the community, and be aware that it can happen, and it's a reflection of proper public health use of guidelines for controlling communicable disease. So I think that covers the things I wanted to add to my report. As Frank and anybody else would say, things change day by day and sometimes even more rapidly. So it's hard to keep everybody up to date. Thank you.
Thanks. Yes, Ed, go.
Sorry there, I was muted and I couldn't access the button. So one of the problems of Zoom. Ravinder, nice to meet you. My name's Ed Kopel, one of the board members. Bill, I had just a couple of quick things. Is that, first of all, has Tompkins County then adjusted their isolation times to 10 and 20 days respectively?
We have, although it's not official New York State Department of Health recommendation at this point. We understand from weekly meetings with the infectious disease division of the department that they are working towards implementing those particular parts of the CDC's guidelines.
And also, I want to say I appreciate the document that you put out regarding the influenza-like illness or COVID-like illness. That was very helpful. And also that I think too that, you know, like providers in our area should be aware that they shouldn't necessarily be bringing just mild cases into their offices of COVID. That they should be doing that by telehealth and ordering just testing and people just to go to the sampling site without being necessarily seen in person to reduce risk to medical staff. So I think it looked like that's what kind of you were encouraging in the document that you put out.
Yes.
Yeah, and that's what we're trying to do certainly too in our office. Thanks.
Yep, you're welcome, Ed.
And Dr. Claypack, I was wondering, is the Department of Health still doing contract tracing for the whole county, or are the colleges taking over for themselves?
Well, things get divided up into various categories. And Frank, correct me if I misstate anything, but any positive case is taken over by us at the health department. So we follow all of those positive cases to the point that we release them from isolation. Where things get divided up is if people need to be in quarantine. So if it's a Cornell student that is requiring quarantine, Cornell Health is following those students and maintaining contact with them. We get involved with certain quarantine individuals in the community in general, but not with Cornell's. But so if it were, say, a Cornell staff person who had to be on quarantine, particularly if it's not related to their employment, we will be involved in monitoring their quarantine. If it's a traveler, although the travel advice from the CDC has changed as of the last few days, if you've seen that. However, New York State hasn't made any changes. So any traveler will be under our also monitoring. Other individuals who are under either preventive or mandatory quarantine will be monitored by us.
So Bill, just a clarification. I live on Route 366 and there's a boatload of people who come in to work at Cornell who actually live outside the county. Who follows those folks if they should turn up COVID positive?
If they're a resident of another county,
Yeah.
we receive the report if they're tested within our county, for example, but then we will
Be followed.
interact with the other county and refer them over.
Makes sense.
Just wait, that's not exactly. So the county of residence is where the positive result is reported to. So say somebody lived in Cortland but worked at, let's pick on Ithaca College instead of Cornell all the time. Say they worked at Ithaca College, if they tested positive, Cortland County would be notified. They do the case investigation. If they determine there were any exposures in Tompkins County, they reach out to our department and we do any Tompkins County exposure investigation or contact tracing.
Mm-hmm. But then let's say that Cortland employee needs to go into quarantine or isolation. It's Cortland County that's following them at that point.
Correct.
Just a quick comment. I'm not sure if this is the case, but Frank, correct me if I'm wrong. I thought Cornell Health was also doing contact tracings as well.
So we're doing the calls. As long as we have the capacity, we are going to make the first phone call. We're going to do case investigations and we're going to make the first calls to contacts as well, because we want to gather information from a non-authoritarian approach or entity. We were a little concerned that if Cornell was making those first calls, whoever they were calling might be telling them what they want to hear versus the full story. And we've had experience with that, and it's human nature. I don't think anyone's doing anything wrong. It's just the way that it goes. So we're going to do the case investigations. We will do contact tracing. Once we've completed kind of identifying the totality of the contacts, then we turn it over to Cornell Health and they'll be doing the daily check-ins for us for those individuals that are in quarantine.
Okay, anything else on this? All right, great. Who is going to do the Division for Community Health report?
I think Dr. K and I have probably covered most everything
Okay.
in there.
Okay. Okay, great. So then Deb.
Hi, everyone. The Children with Special Care Needs Division is back up to normal number of referrals for the past 2 months. So that's nice to see that doctors' offices are now seeing kids a lot more and getting referrals into us. The CSCN staff continues to attend the morning COVID briefings and help out during the week as needed and continue to cover on the weekend. I'm helping out now with the managers retiring down there. I have parked myself right outside of Melissa and Lori's office so I can learn and absorb everything that's going on down there. And we'll be helping out with some weekend coverage for the managers for COVID work. That's it from my division.
Great, thanks. Any questions for Deb? Comments? Okay, Jonathan.
I don't have a report, but I'll just introduce myself to Ravender. I'm Jonathan Wood. I'm the county attorney. Been the attorney for the health department for, I guess, 27 years. I'm your neighbor, sort of. I live at Myers.
Nice.
You picked a fine time to move because as you know, we're doing the Ludloville Bridge project, which affects your driving in probably every night.
Adds a little bit to my commute.
That's done. the state is going to do the 34B bridge, which will also affect your commute. But in 4 years, it's going to be great. So, you know, obviously the staff is here to help you, including myself. So if you have any questions, obviously contact me or anybody else on the staff.
Thanks so much.
Great, thanks. Liz, Environmental Health.
Hi, I'm Liz, Director of Environmental Health, and welcome. I do not have the privilege of living in Ludlowville, although I did visit that area this weekend.
Oh, very good.
And it is very nice. And unlike Deb, things in environmental health are nowhere near normal. We continue to get distractions like 150 gym facilities to inspect and all of these friggin' complaints from all the students coming back and other gatherings. So that's continuing to keep us occupied and pulling us away from some of the other things we were trying to start up in terms of regular inspections. But we're hanging in there and making COVID stuff our priority. I don't have anything to add to my report.
So sorry, you said complaints from students. Is it complaints from students of gatherings?
Complaints about students and others.
Oh, gotcha.
Gatherings, not wearing masks. It is not just limited to students by any means.
Any other questions? Okay, thanks, Liz. So that concludes our reports. And do we have any new business that isn't already on here? And I think Frank also took care of the update of Ravinder earlier on. So
Yeah, I don't know if Dr. Evelyn and Jan want to introduce themselves. They didn't have a chance to.
Sure. I'm Jan Morgan. I live in the town of Dryden. I'm retired from the faculty at Tompkins Cortland Community College, where I taught nursing. And I've been on the Board of Health since I retired. So it's been, I don't know, 10 years at least or so. Welcome.
Thanks so much. It's a pleasure.
And I'm David Evelyn. I'm the medical director at Cougar Medical Center here, the local hospital. And I've been on the Board of Health now 5 years, 6 years, but have worked closely with the Department of Health for 15 years, all the time that I've been here.
Nice to meet you.
And maybe both Skip and Karen can introduce themselves too. I think that will be everybody, unless I missed somebody.
Hi, I'm Skip Parr. I work for Environmental Health. I provide support to Liz, mainly around enforcement actions. Nice to meet you.
Karen, do you want to introduce yourself?
She's like, yeah, sorry to put you on the spot.
Hi, I'm Karen Palazzo, and I take the notes for the Board of Health meetings. And I've met, or in a sort of way, Mr. Kingra. And if you have any questions or notes or anything that you want me to know, just contact me.
Great.
I got your updated information. I thank you.
Yeah, nice to meet you sort of in person.
Yes.
And
thanks for all your help.
Thank you.
And I would introduce Shelley too, but I don't know, Frank, if she's hiding behind her, if she's really there or she just was helping get things connected. Shelley, if you're there.
I think she's there.
I'm here. I'm here. I offer support for Frank and the Board of Health in general if Corinne is not available. So it's nice to meet you.
Nice to meet you as well, Shelley.
I just don't have the camera turned on. Sorry.
No worries. Okay. Yeah.
All righty. I think that's everybody. Did I miss anybody? I don't think so.
The only Greg is the only person who I haven't.
Greg is our county ITS director, Information Technology Services, and so he's the one that's helping us get it streamed to YouTube.
Gotcha.
So I don't think he's actually on right now. I have to text him, tell him where.
Yeah, no worries. If you're there, Greg, nice to meet you.
Okay, so if Frank, do you have anything else that?
I do not.
Does any board member have anything else? Or staff member? Okay. Can I get a motion from someone to adjourn? All right, I'll take Sue as my first and Melissa as our second. Any discussion that we need on this? All in favor? Any objections? I think we're unanimous again, so I think we're good to go. We'll see everybody on September, is it September 28th? I can't remember. Who knows quickly? I think it's, September
29.
No, 22nd.
22nd. Oh, 22nd.
22nd, yep. All right, have a safe month. We'll see everybody in a couple weeks.
Thanks, everyone. Nice to meet you all. Frank, I'll reach out to you about getting sworn in.
Yep, sounds good. Bye-bye.